Hello, everyone, and thank you for joining us today. This is the first in our rural or regional behavioral health coordinators mid-session bill update series. We are about halfway through the legislative session. There's a lot of bills out there regarding behavioral health, so we just wanted to take some opportunities to go ahead and give all of our stakeholders an update as to what some of those bills are looking like now, since they may or may not have been amended or heard, what the current status is, and what we can expect moving forward. Today's bill that we're starting out with is Senate Bill 165. So, quick disclaimer, the purpose of this webinar series is to provide information that will help our stakeholders keep track of the progress, content, and anything else relating to active bills in the current legislative session for the Nevada legislature. We are not intending or asking for you to take any sort of action or stance on the bills presented. This is for informational and educational purposes only, and is so if you have any questions, please go ahead and reach out and let us know. That being said, some quick housekeeping. This webinar is being recorded and will be posted to YouTube at the handle is NV Rural RBH. Unless otherwise specified, go ahead and hold questions for the end of the presentation. If Dr. Rains decides to open it up for questions midway through, by all means, we can do that. But unless she says that, let's go ahead and hold on to them. We will be able to hold time after the presentation for Q&A. Unless you're talking, please go ahead and keep your microphone off. The way that this webinar platform is set up, it shouldn't be a problem, but later on when we do open up for Q&A, that might come up. We just want to make sure that we don't have audio that is messing with other people or speaking over other people. I also reserve the right to mute anyone who may accidentally forget that and accidentally leave their mic on. So I'm not trying to keep anybody from being able to speak their piece, I promise. It's just a matter of we don't necessarily need to hear you yelling at your dogs or what have you. Please keep all comments, questions, and discussion respectful. And I also do reserve the right to remove any participants who engage in any subjectively inappropriate or disrespectful activity, questioning, or comments. So a little bit about our wonderful Dr. Rains that we have here today. She is representing the Children's Advocacy Alliance, where she's the deputy director, and she's also the director of the Kids Count initiatives. She is a licensed psychologist and has just been a really great person to work with throughout figuring out what these bills mean, what they look like, and has been taking some really innovative approaches there. And without further ado, we're going to go ahead and talk again about Senate Bill 165, which creates a new bachelor's level behavioral health provider type. And I'm going to go ahead and turn it over to Dr. Rains. You're on mute as well.
I am muted as I'm telling you that I am going to now share my screen. So thank you so much for joining and to learn more about this bill. I am from Children's Advocacy Alliance, and we are a statewide nonpartisan nonprofit that's committed to using coalitions largely to move the needle on policy and practice in the areas of early childhood, child welfare, and children's health, physical and mental health. And so we're excited that we are able to present out of the work of our Children's Mental Health Action Coalition, SB 165. A little bit about our mental health work. So our Children's Mental Health Action Coalition actually launched in December 2023. And with that coalition, we did a needs assessment. People chimed in. We have trainers, we have providers, we have insurance representatives, we have parents, we have youth. It's a really a mixed group. And we started talking and we decided amongst ourselves, what are the most pressing issues in children's mental health? And they gave us a list of issues, and then we kind of went nationwide to look and see how we could come up with solutions that would meet the need that the coalition determined. Also, I want to go back. Thank you for the chat. I want to go back and say you all are free to ask questions as we go. So if anything comes up, just come off mute, just yell, and we can kind of talk through it, because I want to make sure that this is an opportunity for us to have a conversation about some of the things that we're working on. So the coalition came up with a list of priorities, and workforce was, of course, one of the primary priorities, right? We don't have enough practitioners in Nevada to meet the need. We see it in our lack of community-based services. We see it in the lack of providers who are able to take Medicaid. We see it, I'm sure you all see it and feel it in the rural communities. And so we started thinking, like, how can we address this? And one of the models that we found to address this was at the Balmer Institute. And so I want to talk a little bit about the work that they're doing in the Balmer Institute as we go through the bill. So this bill in particular has three primary pieces that will grow our children's behavioral health, mental and behavioral health workforce in Nevada. So the first piece, and that's the piece that I want to be available to answer the most questions about, is that prevention-oriented practitioners, that bachelor's level workforce. The second part of this bill is helping us build doctoral level child mental health practitioners. And then the third part of this bill is an overall investment in the workforce. So why? We know we have the 2020 problem, right? 20% of all youth have some type of major mental health disorder, and 20% of those youth who have a mental health disorder are able to seek professional treatment. And these numbers are based on national numbers. We know that that's even fewer youth in Nevada are able to access treatment and care. So, and I got this graphic from the Balmer Institute because I feel like it captures. If we look at the last 20 years, the number of youth needing this more severe, more intensive mental health support is growing, right? So if we look at these greener, healthier leaves, these are kids who are the wounded well, who may benefit from like in-school interventions or just a touch point, but don't really need much. These kind of starting to wilt leaves are the kids who do need some intervention, right? These would be those kiddos who are at highest risk for the development of major mental health disorders. And then these wilted leaves are those kids who are suffering, those kids who do need the support, major mental health support. We also know that there are trends in adolescent depression and suicide, right? That they're trending up. And if you look at our state compared to other states, on a national survey, 54.4% of youth in Nevada or families in Nevada reported finding it difficult to impossible to get mental health care. And these are the ones who are looking, right? Because we know that there are always kiddos and families who are suffering but don't have the awareness to even look for the support. So what we're proposing as part of SB 165 is a new child behavioral health workforce. So with our existing workforce that we have, and again, this is based on a national model, we're able to support about this many kids, right? Like very few of the kids who even need that high mental health support are able to get that support. It's really difficult to kind of serve these kids in the middle at highest risk, and oftentimes we don't even touch the kids that we deem or perceive to be healthy. So we feel the solution is a bidirectional approach to address both prevention and intervention. So the prevention-oriented practitioners, these are behavioral health and wellness practitioners. And so what we're doing is we're establishing this professional, which would be a bachelor's level professional who has the training to do health promotion, early intervention, screening, and prevention type work. So with this model, and let me just go back and say, they're doing this in Oregon. For children. They're doing it in Washington and in other settings, adult and geriatric settings. They've been doing this in the UK for decades. And what they have found in the data from the National Health Service is that the number of youth who need that intensive support has dwindled as they're able to work on the front end and do some of the preventative work, right? So with our existing mental health workforce, and like I said, I got these slides from Balmer, so this is being recorded. I wanted to make sure I gave them credit. With the existing workforce, we can only serve these few kids, right? But with this expanded prevention-based workforce, we're able to serve many, many more kids along the continuum. So the key definitions to this new profession is they will be licensed to practice behavioral health promotion and prevention. It will be a supervised practice, so they will have to practice under someone who's licensed. And then the scope of practice does not include diagnosis, psychological assessment, or any type of psychotherapy. They are not going to be trained to do that. The education will be a bachelor's degree. As proposed in this bill, these degree programs will be housed in psychology, social work, and human services. So we're hoping to partner with Great Basin College, with University of Nevada, Las Vegas, with UNLV, and with UNR to get these done. And in each of those universities, this program would be housed in a different college. Um, Training. So they have to have hands-on experience. What's really cool about the way this training model is shaping up is it looks like 2 years of coursework, those general ed classes, and then 2 years of coursework with practica. Because we know that many behavioral health bachelor's degrees, people graduate and they've never touched a person, right? They are not or worked with a family or seen a kid, right? And so these folks will have the opportunity to practice parent interviews and do some of those prevention works and group settings and see what it means to do some of that health promotion and prevention work in real time under under a supervisor before going out to practice under their licensed supervisor. We've proposed an ethics exam. And then these folks can be supervised by a number of people, including licensed psychologists, licensed social workers, licensed counselors, and APRNs. So again, this is what it would look like. 2 years of core education, bachelor's degree requirements, and then 2 years of coursework and then community-based practice in schools or in community settings like communities and schools, Boys and Girls Club, places where children are and where having folks who are trained in prevention, trained in de-escalation, trained in health promotion would be helpful for kids. So we've got our 3 partners here. Any questions, comments, thoughts, sensations about that bachelor's level professional?
Quick question. So, Dr. Rains, do we have any idea of what type of training and what that like bachelor's level training would look like at this time?
So these programs are working with folks up at the Balmer Institute, so that the training that we are giving in Nevada mirrors in some ways the training that's being done in Oregon, and that is so that this degree can have some mobility. So beyond the training and prac integrated final 2 years, that's about all that I have that I can share at this point.
Gotcha. So we do have a question in the chat from Nancy. Have you
Yeah.
considered certification? It's a little weird to have a licensed professional supervised by another licensed professional.
Yes, and they do it in other places, Nancy. The reason this is a licensable program instead of certification is we want to make sure that these folks are reimbursable. So there are a number of prevention and case management codes, both with our state Medicaid and other insurance companies, and we want to make sure that these are services that can be captured and paid for. Thanks, that was a great question.
Awesome. And then, on that note, quick question, is this something that is this position one that would become like a Nevada Medicaid qualified mental health provider or a qualified mental health associate? Or what are kind of the current thoughts on that?
Yeah, so that again, that's another thing. It's so tricky doing these, right? Because there are things that I know and things that are just still being kind of worked out, and so I can't speak definitively to yet, but there are conversations about which one of those would be the closest fit right now. It hasn't been decided. Yes, we did have an amendment, Mark. I see your question. Did an amendment remove insurance reimbursement for the services? It removed private insurance reimbursement for the services at this time. The reason for that is this construct that I learned about called federal defrayal. And so essentially, if Nevada requires providers to cover anything that's above and beyond what the federal government requires, then Nevada has to pay the difference. That's my understanding of what that means. And so because of the fiscal note that will come from that, the private insurers are no longer mandated to cover it. But we're hoping that they'll be good citizens and cover some of the services because they do have prevention codes. Other questions? All right, if there's no more questions, I will keep rolling through the other portions of the bill. So the second portion of this bill looks at doctoral level practitioners. And so we currently, I'm sure you all are aware, do not have a child-focused APA accredited internship in Nevada. And so what that means is that if anyone wants to do a child internship, they have to leave the state and we hope they come back. An APA accredited child internship. Now, we know that there are folks who have put together incredible internship experiences here in the state, and they've had to go that extra step of creating the documentation to demonstrate that it is equivalent to an APA accredited internship, right? And so we want to make sure that we can grow our own. We know that people tend to postdoc where they internship and get licensed where they postdoc. So this is another path to increasing the number of practitioners and professionals we have here in Nevada. And so just this picture shows, and this is from Mallory Constantine, who is uh, I believe she's a staff, she might be a postdoc at UNLV. She put together this slide as part of her presentation. If you look at our neighboring states, it's kind of wild that we don't have any at all. And so this part of the bill would give the funding to get an APA accredited child psychology focused internship up and off the ground. And the
Um,
last piece, go ahead, sorry.
Dr. Rains, if you can
Yeah.
speak to that a little bit more about how that would work, that would be fantastic because I know that's been a major point of discussion in different legislative and policy hearings. And when we're looking at bolstering our workforce long term, that's a major key piece.
Yeah, so how that would work is right now, what's proposed is an internship being developed in partnership with the UNLV practice. And so it would initially be Southern Nevada based, this internship. And I'm not sure if you're familiar, with psychology, there has to be a 1 year internship to like close out the doctoral degree. And so this will allow folks to do that. They'll spend the year doing community mental health services. I'm not sure how it will integrate with other systems. We're getting a comprehensive children's hospital in Southern Nevada soon. And so like my diabolical dream that I am sharing on YouTube is that there will be some partnership between the hospital and the internship, but all of that is my only, I don't know that anyone's actually talking about that yet. What we're talking about right now is really just trying to get the funds to get an accredited internship. And we know that depending on the size and the staffing of that internship, they could graduate anywhere from 8 to 12-ish, I believe, doctoral students a year. So that would be 8 to 12 new folks in Nevada with specialty in child psychology, serving our population who are ready to postdoc and hopefully get licensed and stay here. Does that answer your question?
I believe so. Yes. Thank you.
Okay.
And we have a question from Nancy. This bill only provides one internship or all eight?
That's a great question, Nancy. I was not clear. It covers the program. So it should be 8 to 12 per year people coming out of the program. So this bill is going to build the training infrastructure for folks to come into. It won't actually, yeah. So it should
Thank
be.
you. And with that piece, is that something that's also maybe being looked at in conjunction with Be Here Nevada,
Oh
the
yeah.
K-12 through professional practice workforce development pipeline?
All of that. Be Here Nevada has been an excellent partner in thinking through all of this and how it aligns with what they're working on. So yeah.
Awesome. Thank you. I think we're set to go.
All right. And the last part of this bill is investing in workforce development. So, the current cost of most child behavioral health degrees is expensive. We know on average student loan debt in Nevada is about $34,000 is what folks hold in student loan debt. So we don't want cost to be a barrier to getting people into the field. We know that there's tuition, fees, licensure exam preparation, all of that. And so the average graduate mental health degree in Nevada costs from $30,000 to $50,000. And we want to reduce some of that burden and water our own crops. So the third part of this bill is a scholarship and assistantship funds to incentivize students to pursue careers in child behavioral health. So it's each university, I believe, will get part of a pool of scholarships that students can apply for. And this will help create our pipeline of child behavioral health professionals. From my perspective, those with lived experience. Um, because we know that there are folks who come from backgrounds where they can't afford to go to graduate school, right? Like I think about my own graduate school experience, for my internship, I made, I think it was like 12 or $15,000 a year to live in Los Angeles for a year. I couldn't have done that without support and family and all types of other privileges that not everyone has the luxury of having. And so we want to offset some of those costs as a way to help grow our own. Another aspect of this bill is micro credentials. So with the money that's going into the BA training program, there's also funds for micro credentials. So this is another thing that they're doing up at the University of Oregon. They've got micro credentials that they're offering to teachers and folks who already work with kids but don't particularly want to get an additional license. And these are explicit skills related to prevention and health promotion, including helping with de-escalation and help and co-regulation. And so it also teaches teachers some of the risk factors for mental health disorders. So what this bill looks like, these are the investments that this bill is looking at right now. So as you can see, investing in scholarships is the largest piece of this. And so in summary, this bidirectional approach to supporting Nevada's youth really will help grow our workforce quickly and with quality. We've got the prevention-oriented professionals, we've got a doctoral internship funding, and then we've got scholarships to help us build a robust and diverse workforce. And these are my thank yous.
That was fantastic. Thank you so much, Dr. Rains.
Of course.
A quick question. I know we've had some of our local level stakeholders ask, how does this credential, particularly the behavioral health and wellness provider type, how does that work in with community health workers, peer recovery support specialists? Are they different? How are they same? What's the vision and thoughts on that currently?
Thanks. That's an excellent question. So they are different. And we see this as an and, not an or, right? Like we know that in different communities across the state, there are different needs. I mean, and again, one of my other secret hopes is that this will be a path, that the bachelor's program will be a stepping stone for folks who are doing that community health work, who are interested in mental health to make money as they move through and matriculate through higher degrees if that's what they want to do, right? We know that community, there's a crosswalk that's been put together that delineates all of these different degrees and all of these different, what these folks are able to do. With as far as the prevention specialists, we know that their wheelhouse is really substance use prevention and systems level substance use prevention, right? Whereas we see these behavioral health and wellness professionals as being like boots on the ground in the schools, in community settings and working with children and families more directly. And community health workers can partner with the behavioral health and wellness specialists effortlessly, right? Like let's say, for example, a student screens at risk for depression and a family needs support in navigating the system and finding what they need. A community health worker would be a perfect partner to pull in and support some of that navigation and help the family learn the lay of the land and better understand what resources and maybe co-regulate a little bit in the house. So there are definitely ways in which all of these professions fill a very distinct role in what we need to really kind of quickly and efficiently and with quality move the needle and improve our children's mental health outcomes.
Fantastic. All right, I'm going to open it up to Q&A. We have a couple people with us. So if you're interested in asking a question, either raise your hand, drop it in the Q&A, or you can drop it into the chat.
See.
All right. All right, Mark, I have
Oh, hello.
go ahead.
Hey, Mark.
Hey, I was gonna put my question or my comment or question in the chat, but I think this seems like a good. The more I see this, and this helped elaborate on that. I hope that I think Valerie, hopefully you'll put the slides with the or give us the slides too. But it seemed like I've been calling this like a preclinical addition to the continuum. I don't know
Yeah.
if that's
Yeah,
accurate or
it
not.
is.
It's like it's not quite. It's not regular prevention, upstream prevention. It's not mental health, social work, and but like clinicians. But it's a good stepping stone, and it sort of adds something to the continuum. I do think I'm on the Nevada Certification Board, and there has been some confusion about the difference between, the upstream prevention certification and this behavioral health prevention and wellness. So I think anything we can do to sort of um, outline or elaborate on that more. You did that here already, but I just think that that is a bit confusing to some people until they, learn more about it. And so one of my questions was, does this just serves children and youth and not adults? Like, I mean, it what I know it serves families, but what about individual adults that don't necessarily have family issues and stuff?
Yeah, so that's a great question. At this point, the training programs will only be able to serve children. The bill language with amendments is such that at a later time, if we get new training programs and it expands, they could serve across the lifespan. But we wanted to be focused and intentional to get this up and off the ground and see how well this fits into our Nevada landscape, right? Like you said, it does have a unique space, and I'm happy to talk with anyone from the certification community who has questions and offer some clarity on the difference between what these folks will be doing and what some of our other folks are
Yeah.
doing.
And then the only other thing is I was disappointed to see that the insurance I know that's a complicated factor, and I understand why it was removed, but um, that was a little disappointing because I think it'd be nice if we could find some pool of funding to help people that don't have or that aren't covered by insurance or I'm not sure, is Medicaid covering this or is this strictly at the provider's discretion?
We have spoken with Medicaid about covering this, and they are seem optimistic that there are codes that this could be covered under.
Okay.
We also spoke to the Medicaid in schools folks, and it should be I don't want to say easy because I don't know that anything with Medicaid is easy, but it should be a relatively low lift for these folks to be reimbursable for services provided in schools, because they'll be working under a licensed professional. So we're optimistic that this will really close the gap. And I will tell you, going back to that insurance piece, there's a national org that sets the regulations for what preventative services insurance carriers are mandated to cover. And I will tell you, the application is due April 15th. And I know because I've been so frustrated with this aspect of it, that I am considering applying for that national group. So I don't know if they'll take me, and I probably shouldn't be blasting out my ulterior motives for why I want to join on the internet. But it is frustrating. I think there aren't any child mental health preventative services that are mandated to be covered right now. And so that
Mm,
feels like a huge miss on our part, kind of globally as a culture and as a society. Um, I think if you think about where these folks can fit in, like really think about those kids with the green leaves, like there are programs like check in, check out that we know are incredible for kids at home. I'm not endorsing them, but according to some ROI, return on investment studies, these programs can save us $15,000 per child who participates in this low-level intervention. And oftentimes we just don't have the personnel in the schools to do these low-level interventions. And so this is an opportunity for us to put someone who's trained to do those types of interventions in community with children to reduce the escalation of and likelihood of mental health disorders.
yeah. And Valerie, I'm sorry to continue, but
Oh, you're good.
as you when I think about the field or the continuum, as it gets a little more, full, it would be good, I think, for those prevention specialists that are already in the schools to make sure that there's some sort of communication and collaboration on with them, so there's not some turf issues and things like that, and so they understand that. And actually, one of my concerns about community health workers is that, and even peer specialists, but is that there's a lot of community health workers out there, but they don't have a lot of clinical support because of the shortage, especially in the rural areas. And that would be my other question is how can we get some of this into the rural areas? But I would encourage some collaboration and communication and some clarity around the roles and so there's no like turf or because sometimes if they don't understand that this is different and then the schools start, I think it'd be great to have these folks working side by side with those community health workers and prevention specialists in the schools because I fear that sometimes they're not getting the support that they need, and they're actually susceptible to actually playing therapists because of you getting outside the scope because they don't really have somebody to guide them. I mean, obviously their own organizations do, and some of them do have clinicians, but that's one of the things that I've seen is that there's a lot of community health workers out there and not many peer specialists, but they often don't have the clinical stuff. So I think that would help clarify the boundaries and the hopefully reinforce the need to collaborate on that.
I agree. I agree. And one of the ways we hope to get it to the rurals is by partnering with Great Basin, right? So that was an intentional move because we know that they serve our rural communities. They've got connections out there that our two bigger universities aren't always able to make. And so want to make sure that this is accessible for folks out there. Nancy, I see your question. Would this be effective immediately or would it need to get passed a second time? So it passed out of committee. And so what that means is it still has to go through the Ways and Means Committee, and then it has to go to the Senate. So right now it's passed out of Assembly. It goes to the Senate. In my dreams, I'm so excited. I can't wait for it. It's going to pass out of the Senate and then go to the governor and be signed into law, and then we're good to go. So it's not like a ballot measure where it has to go through a second cycle. Hopefully we'll be ready to rock and roll by June.
All right, last call for questions.
I'm around. So shoot me an email. We can set up a call. I just put my email address in the chat. If there's anyone who wants to talk more about this, has ideas, as part of this bill, there will be an advisory committee to support the psychology board with the licensure in the beginning. I'm sure there will be work sessions that get going on creating the scope of work. There are ways to contribute to this and make sure that all voices are heard, and we want to make sure that people feel included. This is a common goal for all of us, right? To improve our mental health workforce, to grow it, to give kids access to the care they need, and to prevent the escalation of symptoms for kids when there is space to prevent that escalation. And so at CAA, we're just excited to work together as a team with folks across the state to get this work done.
All right. Well, thank you so much, Dr. Rains. I appreciate you so much. This has been really great to learn more about this bill. Again, this webinar is being recorded, and I will try to get this up either today or tomorrow on our YouTube channel so that it can be shared out to anyone who may still have questions. My email is also in the chat, so if anybody has questions about other webinars or other bills you'd like to hear about, please feel free to let me know. And any parting comments or thoughts, Dr. Rains?
No, just thank you. And again, please reach out. If you hear people who are confused or who are having big sensations about this work, give us a call. Let's talk through it. I can't promise that everyone will be happy with it at the end. In fact, one of my first supervisors as a psychologist a long, long time ago told me that if everybody's happy, you're probably not doing your job. So I sometimes stick to that to a fault. But definitely let us know so we can try to find some middle ground because like I said, we do share a goal.
Excellent. Well, thank you again, and I hope that everybody has a great day.